Hello everyone. Today we'll be talking about facial nerve. Facial nerve is a seven cranial nerve. It is mixed nerve because it composed of both motor and the sensory. So we can remember facial nerve with 3, 4, 3, 5 rules. Okay, 3, 4, 3, 5. 3 means 3 nucleus. 4 means its course. 3 again 3 means Petrus pathway. 5 means terminal branches. Okay, so seven cranial nerve, it is a mixed nerve composed of both sensory and the motor. So what are the nucleus? They are nucleus tractus solitarius, motor nucleus, and nucleus salivatorius. Okay, so nucleus tractus solitarius and nucleus salivatorius combines and form nerve of resport, that is also called as nervus intermedius. Now this facial nerve initially arises as motor nucleus and it encircles 6 cranial nerve. Okay, it composed of 4 segments. They are intracranial, intrameatal, intratemporal, extratemporal. Okay, these are the 4 segments. With this we can remember all the course of the facial nerve. Initially the course will be as a intracranial, then meatal, and then extra and intratemporal. Okay, in its Petrus pathway, it includes a labyrinthine segment, horizontal tympanic segment, and a vertical mastoid segment until the stylomastoid foramen. Okay, now let us talk with the figure. So initially you can see in the figure, this is motor nucleus. It arises. Okay, it encircles 6 cranial nerve and it reaches the internal auditory canals. Okay, so the nucleus tractus solitarius and nucleus salivatorius combines and form nervus intermedius. This runs along with the facial nerve course, motor nucleus course, but it doesn't fuse over here. But it fuses at terminal stage, and it comes out from the metal foramen. Okay, and you can see the same figure in this here over. Okay, and from the metal foramen it comes out and runs in the fallopian canals. Okay, so it can be divided into 3a, 3b, and the 3c. 3a is labyrinthine, 3b is horizontal, and 3c is vertical. Okay, now it comes out from the stylomastoid foramen. Okay, so let us see in next figure. Now this course is this is a middle ear cavity course. Okay, this is the wall of middle ear cavity. So the same things over here. Now after 3v it gives branches, first motor branches, that is nerves to stapes. Okay, and after 3a there is ganglion, that is genuganglion. Okay, genuculate ganglion. So it gives 3 branches. They are superficial greater superficial petrosal nerve, deep petrosal nerve, and external petrosal nerve. Okay, we'll be talking furthermore. Okay, so first, second, and third. Okay, this first is from motor nucleus to internal auditory canal. Second course is from meatal, which is this in this course, and this is intracranial. Okay, and this is intratemporal, and this is extratemporal. Okay, this is intracranial, intrameatal, this is intratemporal, and this is extratemporals. Okay, so intracranial is first, this is second. This can be divided into 3 parts: 3a, 3b, 3c. First, second, and the 3a doesn't have any branches. After 3a there is ganglion, genuculate ganglion. It gives branches to 3 nerves. Okay, and after 3b it gives branches to that is stapes, that is nerve to stapes. Okay, which is the first motor branches. And above the stylomastoid foramen it gives branch to cola tympani. Okay, so this cola tympani, it runs posteriorly and it goes and it forms canal of Augier. Okay, now same things after giving branches to cola tympani, and the same course runs along extracranially. After stylomastoid foramen it is called as extracranial. Now it runs and it reaches parotid glands. It divides into 2 lobes and gives 5 branches. They are temporal, zygomatic, buccal, marginal, and the cervical. Okay, same things. Now let us start from the beginning. Branches of the facial nerves. Okay, from first genu 3 branches: greater superficial petrosal nerve, lesser petrosal nerve, and the external petrosal nerve. Now first, this ESPN, which is parasympathetic. So it must receive sympathetic nerve fiber. So it receives sympathetic nerve fiber from deep petrosal nerve. Okay, so first GSPN carries preganglionic fiber, goes to middle cranial fossa through peritympanic fissures, and also receives deep petrosal nerve, arises from the tympanic plexus, which is sympathetics. Now this GSPN and the deep petrosal nerve forms PDN nerves, enters pterygoid canals, which is a part of sphenoid bones, and rests on pterygopalatine fossa and consists of pterygopalatine ganglion, which is postganglionic fiber. Now this supplies to nasal, lacrimal, minor salivary gland and taste in palate. Okay, so GSPN, which is the first branch of the facial nerve. Okay, now let us talk about lateral petrosal nerve. Lateral petrosal nerve carries major fiber from glossopharyngeal nerve and goes to infratemporal fossa, forms otic ganglion. Okay, and also carries from auriculotemporal fiber and supplies to sweat and parotid gland. But here it is parasympathetic only. So sympathetic is from fifth cranial nerve. So lateral petrosal nerve itself doesn't supply to sweat and parotid gland, but it supply with mixing with fiber receiving from other branches, other nerves. They are glossopharyngeal nerve and the auriculotemporal nerve fiber. Okay, so this is the course of lateral petrosal nerve. No branches of 3B. Okay, just give another branches that is not to stapes after 3B, which is first motor branches. Okay, now let us talk about chora tympanic nerve. We have already discussed the course of the chora tympani, which run posteriorly and it reaches infratemporal fossa, take branches from the lingual nerves. Okay, it also reap branches from the lingual nerves, relays in submandibular ganglion, supplies anterior to third part of the tongue, and submandibular and sublingual salivary gland. Okay, it supplies to these parts. It also receiving fiber from the lingual nerves. Okay, so lingual nerves carries touch and temperature. Now we have already discussed about these things. Now in the figure you can see same things. Initially there is motor nucleus, it arises from the motor nucleus and it receives two branches from nucleus tractus solitarius and nucleus salivatorius superius. Okay, now it runs into internal auditory canals. Okay, from the metal foramen it runs into the fallopian canals. There is false genu, gives genicular ganglion. From genicular ganglion it arises the first branches to be arises, that is greater superficial petrosal nerve. It runs and it supplies to this part. Okay, same thing you can see over here. Okay, and now this is nerve to stapes, and from here this is the course of chora tympani. Okay, it also supply over here, and this is extra temporal course. Okay, it gives posterior digastric branches to posterior digastric stylohyoid muscles. Okay, and it gives branches here. Okay, so it gives 5 terminal branches, 3 4 3 5. Okay, now same things the figure. So it has four functional component. They are greater somatic afferent, specific visceral efferent, somatic visceral afferent, general visceral efferent. Okay, so these are the four functional component. So same thing, so same course, internal acoustic meatus, genicular ganglion, greater superficial petrosal nerve, supplies to lacrimal, mucosa, palate and maxillary sinus. Same thing, same course. So it gives branch to chora tympani. Okay, so above the stylomastoid foramen it gives branch to chora tympani and it supplies to anterior to third part of the tongue and sublingual and submandibular glands. Okay, and the same things happen here. It supplies to the course runs out of the temporal fossa and gives branch to posterior auricular nerve and posterior belly of digastric. Now it runs forwards and it runs to parotid glands. It divides into two lobes and gives 5 terminal branches. They are temporal, zygomatic, buccals and mandibular and cervical branch. Okay, is a cervical branch. So this is the course of facial nerve. Now let us know about the upper motor neuron lesion versus lower motor neuron lesions difference. Now initially we have to know about the normal things. So in the figure you can see this is motor cortex, this is pons. Okay, this is the nucleus of the facial nerves. Now this nucleus is receiving fiber from here and the opposite sides, This is contralateral sides, this is ipsilateral sides. Okay, this is same sides, opposite sides. So this opposite sides is mainly responsible for this inferior part. Okay, we supply to inferior part of the face, but this same side is responsible for this part. Okay, this main part is responsible for supplying this part, inferior part. Now this is the normal course. Now let us describe in the figure. So if there is any lesion, okay, if there is any lesion over here, so what happens, this is lower motor neuron types, lesion is this region. Okay, so what happens, there will be ipsilateral complete facial nerve weakness, so this side will be gone. Okay, there will be paralysis over here, palsy over here. Okay, and when the lesion is over here, what happens, because it gives fiber to this area. Okay, so normally lower inferior part, so this part will be gone. Okay, so this gives over here, this lesion is over right side, so what happens, palsy will be at where, it will be on left sides, lower half facial palsy. Okay, on left sides. So this is normal thing, this will be normal. If there is palsy over here, we have to suspect it is of upper motor neuron types. Okay, I think you have understood these things. Now let us move forward. So now let us define Bell's palsy. So Bell palsy is three things, composed of three things: lower motor neuron types, ipsilateral palsy, and idiopathics. Okay, what is the pathogenesis of the Bell's palsy? Normally the Bell palsy is caused by viral infection. Okay, like herpes zoster or something else. So when the viral infection take place, there will be inflammation. When there will be inflammation, there will be swelling. Okay, so where is the swelling? The swelling will be on fallopian canals. Okay, so that will compress labyrinthian parts. As a result, there will be ipsilateral lower motor neuron lesions. Okay, next cause of Bell's palsy is hypersensitivity and autoimmune. So there are three causes normally. Others also are the causes of the Bell's palsy. So viral infection, hypersensitivity, and the autoimmune. Okay, with this I have completed the course of the facial nerves, upper motor neuron types, lower motor neuron types, and the Bell's palsy. Hope you have understood. Thank you.